Very good. We have had 9 excellent presentations. Now we come to the 10th excellent presentation of the day. Competitor number 10 is Ann Ojeda, a geology PhD student who will be presenting Geology, Chemistry, and Public Health in the Gulf Coast.
Do you ever think about where your water comes from, or the journey that it took to get to your cup? In many places like the Gulf Coast, water is held in underground reservoirs called aquifers, where water saturates the pores of rocks beneath the surface of the earth. It typically enters in a recharge area and then flows down gradient about a foot a year, tens or hundreds of miles until it's withdrawn from a supply well. So water could stay in the earth hundreds or thousands of years before being withdrawn for us to use in cooking, to bathe, or more importantly, to drink. So this journey is an important one. My research is concerned with the geology, the chemistry, and the public health impacts of that journey in the Gulf Coast aquifer system. Why the Gulf Coast? Well, it's unique in that it contains low-rank coal called lignite. You might be familiar with coal as charcoal briquettes. That's high-rank coal, it's mostly carbon. The lignite deposits in the Gulf Coast contain carbon, but also a high percentage of hydrogen and oxygen, making this organic material more soluble in water. Do you see the problem? I work under the lignite groundwater hypothesis, and it states that as water is on its journey from the recharge area to the supply well, it comes in contact with low-rank coal and mobilizes organic material along the way. The local population then ingests this water, and the coal-derived material contributes to the development of kidney disease. I test this hypothesis by characterizing the water-soluble fraction from Gulf Coast lignite. I then compared the organic type and functionality to groundwater field samples from the area. We found that the leached material contains a high percentage of oxygen-containing compounds. So I plan to assess the toxicity of this water-soluble fraction on a cellular level so we can better understand what types of organic matter may pose the greatest threat to human health. I also take a larger view of the problem and have collaborated with the OU Health Sciences Center to generate a health risk assessment for several Gulf Coast states. I calculate rates of end-stage renal disease at the county and zip code levels for Arkansas, Texas, and Louisiana. And we found within the lignite seam, rates of kidney disease are 2 to 3 times more prevalent than surrounding areas of the states. I'm currently working to understand how confounding factors like diabetes, socioeconomic status, and race may also play a role in rural parts of the Gulf Coast. I use my training as a geologist and a chemist to better understand how lignite deposits affect groundwater quality, to ultimately improve the lives of those residents who rely on this water. Thank you.